Hello and welcome to UroChannel. Ever since I uploaded videos about Peyronie's disease, bent penis, penile curvature, Chordee, I noticed from the comments I got that my content stirred up confusion over what is regarded normal. So in this video, you will learn about the normal angle of an erect penis as opposed to congenital curvature and Peyronie's disease. My name is Stefan Buntrock, I'm a urologist and sexologist. If you haven't watched my videos about Peyronie's disease and congenital curvature, I suggest that you do so after this video because they will probably answer any additional questions you might have. So let's dive right in and have a look at what is considered to be normal. Penile curvature only shows up when the penis is erect. If your penis is hanging to the left or to the right in the flaccid state, it doesn't matter. This is not what is considered penile curvature. Whether it is bent or straight only counts in the erect state. And here we have a lot of variety that is considered normal. As a rule, there is a slight curvature upward in a normal penis that is erected. It may also be straight, although this is less common. And there may also be a slight downward angulation, or to the left or to the right. As a rule, everything below 30 degrees is considered as normal. If you want to know how to measure it, look out for my YouTube short on that topic. It might not yet be uploaded by the time you watch this video, so make sure you subscribe to my channel to be notified as soon as it will be available. How do you know whether the curvature of your penis is normal or whether you have Peyronie's disease? First of all, if you experience a change. In Peyronie's disease, typically, a sudden change may be observed. One day the penis is more or less straight and the next day it suddenly is crooked. Sometimes a slight pain with erections over a period of several weeks is preceding this abrupt change. Some patients recall a penile trauma during sexual intercourse a few weeks earlier. Peyronie's disease is not a very common disease. It is estimated that it affects 1% of all men. Some studies even report up to 10%. The typical Peyronie patient is a man in his 50s. Age is an important predictor for likelihood. Every few weeks I receive comments from disparate teenagers who have diagnosed themselves with Peyronie's. Just from looking at the respective age, this is very unlikely. I don't say it's impossible, as there has been published one report on Peyronie's in teenagers in the Journal of Sexual Medicine 10 years ago. But this was a series of 32 cases over a period of 10 years from one of the top referral centers of the country. In other words, it happens, but in rare cases. Peyronie's disease is a chronic inflammatory disease with an active phase for at least 18 months. During the course of the disease, the angle very often worsens. Angles of more than 60 degrees are considered problematic as they interfere with sexual function. Congenital curvature is a birth defect of the penis and no inflammation. It is also called Chordee, and usually the penis bends downward during erections, but not in all cases. It results from a developmental defect in the corpora cavernosa that become disproportionate and cause the bending when they fill with blood and start to expand. Very often, Chordee is coupled with a urinary opening not being on the tip of the penis, but more underneath. This is called hypospadias. Many times Chordee is first noted during puberty when awareness about the appearance of the penis rises. According to the severity of the problem, especially with accompanying hypospadias, surgical repair is performed already in the early years. But in less complicated cases that become visible in adolescence, it depends on the deviation angle whether a surgical procedure will be needed to straighten out the penis. How curved is too curved? According to a study in 202 men with Peyronie's disease, an angle over 60 degrees was the only significant predictor of sexual impairment in multivariate analysis. But also aesthetic problems might be a reason for surgical evaluation. Hope that straightens things out for you. Don't forget to have a look at the other videos about this topic. Thanks for watching. Bye bye.